I mean, in general, exercise is important for everyone. The more active that you are, the more effectively your body works, basically. It's the key. We're designed to move, we're designed to be upright and moving around. All of the systems work better for it. It helps you control your weight, it helps you control your blood pressure, your cholesterol, things like that. But particularly in terms of diabetes, it helps on two major factors. One is it makes insulin work better. It's more efficient, so you need less of it, whether that's insulin that you inject or insulin that you make yourself. And the other thing is it provides a use for blood sugar. It helps use up the sugars in the blood. Muscles that are working harder require that as a fuel source, so you're helping to reduce your blood sugar levels at the same time.
Because it gets so much worse when people gain weight, even very small amounts of regular exercise can really help dramatically.
To have exercise keeps your heart healthy, keeps your brain healthy. Exercise produces lots of feel-good hormones. But exercise is not just going out and running and doing loads of exercise, wearing a leotard and all that kind of. It's not. Exercise is doing more physical activity than you're currently doing. And that could be as simple as just taking the stairs if you normally take the lift. It could be things like parking at the far end of the car park and walking an extra few steps. It could be getting off the bus stop one stop earlier to walk that final bit.
The body's more effective and more efficient at using insulin in the event that you are active. The more active that you are, the more things that you can cope with in the higher tempo that you can work at, the greater the demands on the body. And as a result, insulin is used more efficiently.
Exercise helps keep your diabetes under control because exercise burns off glucose, and if your blood glucose levels stay reasonably okay, then you're less likely to develop the complications. Your diabetes is less likely to progress because by nature, type 2 diabetes is a condition that is progressive. It often gets worse over time. And but there are many things that can be done to try and prevent the progression or at least slow down the progression. And one of the major things there is exercise.
We can introduce exercise into our daily lives in so many ways.
It's about making it work where you can. So if you're, for instance, working at a desk for long periods of time, can you get up on a regular basis and just walk around? Can you walk over and talk to a colleague rather than call them or email them?
It depends on what my work is, if I'm honest. Up to 12 months ago, I was doing a lot of physical work, and that was fine. Now I've got more office space work, if you like, and travelling around in a vehicle quite a bit. So obviously I'm not getting the physical exercise that I did and what I should really do. I'm neglecting that. I know that. I've got to change that. But there's also the time thing. I mean, I'm working 12, 13 hours a day, and it's trying to fit it in. That is a challenge.
It doesn't have to be, you don't have to go to the gym. You can take the stairs. I mean, just even if you're working in a big tower block, maybe just get off one floor early. So it's a matter of trying to think about your day to try and build in that extra few minutes, getting off the bus stop one stop early. Okay, it's a pain in the bum, you have to walk, but you eventually will build up your exercise tolerance. These are small things that can help people.
Can you make sure you're taking the stairs rather than the lifts at work? Can you go for a lunchtime walk? Can you get out and move around? If you currently do nothing at all, the best bet is to start gently. Try and get up a little bit more often, move around a little bit more often, do things like park slightly further away from the shops and walk a little more. Go up stairs rather than escalators. Just try and find little ways of adding some movement into your daily routine. That doesn't have to be high tempo, it doesn't have to be things that get you completely out of breath. Anything that's more than you're doing currently is a good thing. Okay, moderate exercise, you're looking at stuff where you're breathing a bit harder than you normally would, but you're not out of breath. You could talk to somebody, you could sing while you worked if you wanted to, but you'd be getting warmer, you'd feel that you're doing something. That most people can achieve within reason. So small bursts of it should be fine, and it's all about what's applicable to you. So it's moderate for you rather than an athlete or a sedentary person that's standing next to him. It's you personally and what you feel you're able to do. Most forms of exercise are applicable. The Chief Medical Officer has a guideline of 150 minutes of moderate aerobic exercise per week. Essentially, it's movement that causes you to feel warmer and to breathe slightly harder, but still be able to hold a conversation. So that could be walking, riding a bike, swimming, using a gym, playing with the kids, getting out and doing the garden. Even some fairly vigorous housework will have the same effect. The 150 minutes, that can be split up. It can be in 10-minute bursts, it can be in 30-minute bursts. You could do 5 lots of half an hour a week. You could do it in one great big burst on a weekend if that's time and capacity allowed that to happen. That would be deemed as moderate exercise. Vigorous exercise is that higher tempo stuff where you start to glow, you start to sweat, you're definitely feeling much warmer, you're breathing much harder. something that you couldn't hold down a natural conversation. You could respond, but you couldn't talk for long periods. You'd find that there's a finite amount that you could do. You couldn't continue it. That's running, or faster running, longer running, swimming. It might be playing a game of football, a strenuous sport, coming to the gym and do a class, something like that. That should be 2 lots of 75-minute bursts a week. Again, you can split them into smaller periods if necessary.
Muscle strengthening exercise. These should take place at least twice per week. This means working the body against resistance. Things like dancing, stepping or jumping, exercising with weights or carrying and moving heavy loads.
The best thing for a patient who's looking to introduce more exercise into their life is speak to their healthcare professional, their doctor, the practice nurse, the care professionals within the hospital that they're working with, and ask about exercise referral. That's the safest method in, it's the most appropriate method in. There are schemes that run all over the county. Particularly in the case of diabetics, if you're looking to become more active in a safe manner, an exercise referral scheme is an excellent way of learning what's safe and appropriate for you and have instruction in that, whilst at the same time have somebody monitor your levels to make sure that you're working appropriately but not too hard. So exercise referral schemes tend to take the form of group classes. They will be circuit in nature, so you'd work around a series of stations designed to work you aerobically, so make the heart and the lungs work, that system work better, to work your strength, give you functional strength, give you improved movement. They're generally group sessions because they're easier to manage, they're social groups, and you can see that you're not alone. There are plenty of people with conditions that need to work on, and they can work at a similar tempo. But there are other organisations as well, so there's walk schemes, there's outdoor exercise, there's cycling. There's lots of different activities that we can try and promote and give guidance in.
Exercise burns off sugar. So generally speaking, if you start to exercise, your blood sugar level will gradually fall because you're physically using that fuel in your body. If you exercise regularly in a gentle fashion, then your body will be used to it and there is no need to alter your diabetes medication or what you eat. So if you walk to work every day, there's no need to worry about how that's going to affect your sugars. If, on the other hand, you suddenly take up a new sport or suddenly take up a new prolonged and vigorous exercise, then that's going to have quite a big impact on your blood sugars. Your blood sugar is going to fall. If you're exercising for a long time or exercising very hard and you think your blood sugar is falling, the best thing to do is to test your blood sugar and then to treat it. So if your blood sugar is falling, a small carbohydrate snack, so a banana, a couple of biscuits to even things out is a great idea.
So the first thing to do is, if you've got the opportunity, do exercise. Do some. I mean, it doesn't matter what it is, most people can do something, and exercise does not mean buying a pair of trainers, going to run a marathon, wearing a leotard, going to the gym. It does not mean that. It just means doing something more, being more physically active.
If you measure your blood sugar levels, you should check it beforehand. It might be that you need to have a sugared snack or a carbohydrate snack on hand for during the session, or you need to have something beforehand.
And if you have diabetes, particularly if you're treated with insulin or other drugs that can cause low blood sugars, carry some snacks so that you can treat them if you need to, and carry some identification as well, just in case the unthinkable happens, so that other people can help you.
You should certainly make sure that you're wearing suitable clothing, that you have a drink available. Good footwear is essential. You should have something that's comfortably fitting and sturdy. They don't want to be putting any pressure on it.
So if you have normal sensation in your feet, if you're having your feet checked every year on a regular basis, if you've got no deformity in your feet and you normally wear shop-bought footwear, then you want to wear comfortable footwear. Okay, we're not talking fashion. If you're going to do some exercise, ignore fashion. You just need comfortable footwear which is not rubbing on your feet, it's not rubbing on your toes, it's not going to give you pressure ulcers. Wear the footwear that's appropriate for the exercise that you're doing.
Always check your feet, keep a good eye on them, check them beforehand, check them afterwards, make sure that you're not doing any harm or there's no side effects coming off doing the exercise.
Finally, exercise with a friend. Your friend will know that you've got diabetes and they can help if need be, but it's also more fun.